Hello and a very warm welcome to everyone. I am Shija Agrawal and you are watching our series Winning with Antifragility. This is a session titled Digital Healthcare Changing Center of Gravity. Before I deep dive into discussion with this August panel, I would like to spend some time doing some context setting on why we are doing this panel. As you know, we are in the midst of trying times and we are coping with significant disruption around us. The pandemic crisis was bound to bring about a huge change in all aspects economy, politics, and culture. More importantly, it has been a litmus test for imparting digital healthcare worldwide. Experts are of the opinion that the future of health will likely be driven by digital transformation enabled by radically interoperable data and open and secure platforms. In the near future, health is likely to orbit around maintaining well being instead of just responding to illness. We have already seen the digital healthcare sector grow in size. For instance, in 2019, the global digital health market was around $125 billion. There's an unexpected CAGR of almost 25% from 019 to 025, and the digital healthcare market is all set to reach around $660 billion by 2025. Against this backdrop, here's a thought-provoking conversation on what the future of health really is, how digital transformation will drive much of the change, and how the center of gravity will shift towards the consumer rather than around the institution that drive existing healthcare systems. Surely, the onset of so much compromise on health must translate into good news for a sector focused on healthcare, not just due to the outbreak of infectious disease, but also owing to the public health measures to mitigate transmission. These shocks and stressors to the healthcare status were translated to a renewed interest in digital solutions and meant that the need for digital innovation was paramount. And this is exactly what anti-fragility is all about. It just tells you that when you're anti-fragile and when you're under stressors, how do you emerge stronger? The hope was that in the face of such a crisis, the efficiency of healthcare workers would be augmented. Healthcare would be decentralized with minimal physical touch points, and the time that is spent in healthcare facilities would be considerably reduced. The important question to ask really are, will the changes in attitudes COVID-19 has brought about in the matters of health and medicine persist the pandemic, or should they? Is it a changing center of gravity? How have these organizations in this sector responded to so many stressors, volatility, shocks, and disorder to sustain as anti-fragile corporations? To break it all down, we have a pretty meaningful panel. Please help me welcome Dr. Amit Verma, Managing Partner, Quadria, Satish Chandra, Partner, True North, and Meena Ganesh, CEO and MD, Portia Medical. It's my sheer pleasure and privilege to welcome all of you on a Monday afternoon to talk about anti-fragility in healthcare. Nassim Nicholas Taleb in his book Anti-Fragile really said that the resilient resist shocks, the anti-fragile gets better. In the next 45 minutes that I have with this August panel, my endeavor will be really to understand that how do you build an anti-fragile company in the healthcare space, what really are the components for it, and what really are the mental modes of thinking. Let's begin with an open-ended question here and the kind of transactions we have seen in the recent past. For instance, we've had Tata Digital invest in CureFit and acquire 1mg. We've had the corporation that operates PharmEasy acquire a majority stake in offline company Thyrocare, among other things. I have already spoken about the growth in the global digital healthcare market in my opening remarks. My question is that how would you gauge how India is going in the past few years with this new wave of digitization and how successful has it been when there have been rapid and dynamic fluctuations in the manner in which demand and supply has been altered in the healthcare sector? I'll begin with the lady on the panel and then get to the men. Open to you, Meena.
Shrija, pleasure to be here on this panel and along with Dr. Amit and Satish. It's really a very, very critical and important topic that we are all we need to speak about. So you're absolutely right that some things changed as a result of the pandemic, and I'll give you some examples. Of course, what we have to see is how much of that will continue thereafter, and I guess as we go along, we can talk about it. One of the interesting things that happened right at the start of the pandemic, and this was driven entirely because of the pace at which the cases went up, that instead of sending all the COVID positive patients into a facility, the government, when we spoke with them, agreed to have them at home and be monitored with the help of a combination of technology and people monitoring them tracking their condition, and only moving those that really needed movement into a hospital. I would like to believe that that was one of the things which really helped us manage the huge spike of COVID, both in wave one and thereafter in wave two. Uh, just we alone as Portia, we managed about 4 lakh patients and healthcare at home. We partnered them in Karnataka, along with, and likewise, I'm sure other partners would have also supported a number of governments to manage and keep the patients at home through this monitoring. uh, of course, it's not only the private entities such as us. There were a lot of other people who were supporting that. But what this showcased is that there is a place for remotely controlling and observing patients, knowing when to intervene, and then intervening only for those that were required to be intervened. As a result of that, hardly 2.5% of the people that were monitored by us, and I'm sure that must be the case with others also, probably even lesser, needed to be hospitalized. Think about if all the 100% had to be hospitalized, there would have been no hospital beds, even in wave one. Wave two, of course, we saw a different kind of a problem. It was so intense and it needed critical care, but even that, a lot of work. But that is not a digital healthcare, but that was there is a problem that got created, a different kind of thing. But this was, I think, the starting of what we saw as a transformation. The government also quickly came in and came out with regulations for supporting teleconsultations, etc. in last May, April, May of last year, which had been pending for years together. So clearly there was a switch that went off that, hey, there's no other choice. We have to do this. There's no point in arguing. And likewise for the e-pharmacy regulations also changed. So certainly the pandemic has pushed certain transformations which are waiting for years to happen. Of course, there are many other exciting places where technology can be used, and I'm sure we'll talk about it, which could be device led monitoring. It could be for more critical diseases, monitoring at home and supporting at required, helping people with chronic diseases maintain their levels using devices which can help them determine when and how. And then the big problem that we need to solve is that of access to healthcare in the rural and semi-urban areas. How can you bring in digital health to support, to complement what the physical infrastructure that may be already present? So I'll just pause here and come back for further comments.
Thanks, Meena. Thanks for that. I come to you now, Satish, just taking it further from what Meena just laid out. And she sort of really said that a lot of things which were pending for a long period of time really got there because of the pandemic induced digital transformation, which we saw not only in healthcare but across a lot of spaces. If there are two words which were very much bandied around in the entire 1.5 years, it's really been digital transformation. Do you think that the pandemic sort of really brought up the fragilities in the traditional healthcare space? And are we perhaps correct to say that the center of gravity in the healthcare space is definitely shifting towards digital healthcare, and that can truly be the anti-fragile element in the healthcare space one is looking at?
No, sure. Thanks, Shrija. Welcome, everyone. You are in a way partly right. So the way I look at it, I think, is I think that healthcare and pharma, if you include the overall healthcare space, have been slow in terms of use of digital or technology. And when I say slow, when you compare it with, let's say, consumer or fintech. And I think what pandemic has done, and I think everyone was doing something on their own, we're recognizing that this is to come, but we're also taking comfort that probably in healthcare there are so many things in which digital companies to come and disrupt will take time. I think they had some comfort, but I think what pandemic has done is I think it's one pushed all players in the ecosystem a little faster. It's accelerated that change. One is the suppliers or the providers itself. They realized that at least at that pandemic time, there was no other way other than to go digital and provide their services. I see a lot of change at the customer end. I think because they couldn't travel, that was the only means of accessing. And I think also driven, they saw so many other ways, right, in terms of either their own work, the payment services that got really accelerated. If you look at education, that had got really accelerated. Just taking cues from that, I think there was a little bit more affinity from the patients and the consumer end in terms of saying that this is an acceptable way in terms of actually accessing healthcare services. I think that did play a role. Now, when those two happened, I think the other one that we usually sometimes struggle with is doctors in terms of actually encouraging them to come and use digital and technology. I think this was one period in which they got to try, they realized the benefits of it, and we see that stickiness in terms of they've seen the use, in terms of how much it can add to their productivity, their efficiency. And I think that's another great thing that has happened during this period. So in a way, I think this has accelerated quite a bit, and people have, and all players have realized the benefits of it. And when you look at it, even between the first wave and second wave, and we see this experience even in some of our, we have investors in traditional healthcare companies like KIMS, Kerala Institute of Medical Sciences, Cloud9. All of them did roll out digital means of accessing the patients. And during this time, there was good acceptance. We did see a small dip between the first and the second wave when people again got comfortable going into offline facilities. But it was not that major a dip. And I think there was a bit of stickiness. There was a tail customer segment which still found this more comfortable. And I'm sure we'll discuss this going forward. There was also market access in terms of the same healthcare providers reaching out to a wider market. And equally so, many patients who are in areas where they don't have the best of healthcare facilities had more choice open to them in terms of digitally accessing providers or doctors that they were comfortable with. So to that extent, even that got opened up. And I think what we are seeing here now is at the cusp where I think this digital way of providing healthcare and for patients to access healthcare has got sticky, and we'll only see it going forward much as we move ahead in time. So
Okay,
I'll
so the
just
question, yeah, the question really is that this affinity towards digital healthcare, will it outlast the pandemic? Once perhaps one can only hope that 1 year down the line, would people again get back to more traditional mode of healthcare? And whilst we are at more digital healthcare, let's talk about a space within the entire digital healthcare space which has gone in a lot of traction, which really is telemedicine, which distributes essentially health services via telecommunication, and it sure ought to be capitalized at a time when people are teleworking and remotely operating from home. My question to you now, Amit, really, and we're talking about healthcare at home, and I'll also get on to Meena on this, that what do you think really are the shortcomings that telemedicine is facing? And what really should be the playbook to capture a market gnawing with demand in trying times such as these?
Thank you. So I'm going to actually start off with one of my pet peeves, which is the media simplifying everything in digital healthcare as telemedicine. And this is one of those issues which I've had for a very long time. All of us who are in the field have been crying ourselves hoarse about, yeah, there is more to life than telemedicine. And unfortunately,
I
it took a
said,
pandemic.
just to say, I said one space within the digital healthcare space.
Okay,
I did
so
not paint
so
it all with
most
the
of
same
you,
brush.
most of you in the media. Now, having said that, just to add on to what Meena and Satish earlier said, I think there are three aspects, and I think all of us who've been in healthcare, especially in emerging and India, is the following: that we all came up with strategies under fire to safeguard our businesses. So, since nobody knew too much about COVID, the first thing was to conserve cash. You didn't know how long this is going to last. The second thing we started to do was our supply chain dried up completely. And I'm not just talking services, I'm also talking pharma. You had no idea whether you'd say. So simple things like gloves, consumables just disappeared. And the third, which Satish alluded to, and I'm going to take full cognizance of it since I'm a doctor, so I'm allowed to make disparaging remarks about doctors, is we utilize this opportunity to get rid of a lot of cobwebs and dogmas that existed. That this is not possible in medicine. It's never been done before. And for the first time, you were able to go into hospitals and make behavior changes. So, as you rightly labeled this anti-fragility, to my mind, this behavioral change, which is making us more robust, is one of the biggest outcomes. The only sad part is it took a pandemic before we could do it. Coming back to your question about digital healthcare, I think digital healthcare has existed in different forms and shapes in everything that we do, whether it was the front end part of telemedicine, tele ICUs, telepathology, teleradiology, all of us have dabbled into it. But to me, the biggest benefit that I am beginning to see, and since I'm a strong proponent of it personally, is the back end side of it. Things like electronic health records, digitization, point of care testing, robustness of the supply chain using online mechanisms. And most importantly, for the first time, I'm beginning to see a culture in the country that people do believe it's important to document and analyze data. We have a culture of non-sharing in this country. Everybody lives in their little silos. And it took a public health disaster to say, I may not know enough about COVID. Maybe if I learn from these guys, they may be able to teach me some. So, as you ask me the question of what we go forward, to me, the best thing that can come out of this is a culture of sharing, culture of analyzing data. It happens in fintech, it happens in all other industries, but business analytics is very robust. Somehow in healthcare, we never been able to do it. So, if you extrapolate what we have today, I think digital healthcare and artificial intelligence, by the way, one of the two most abused words in healthcare because everybody uses it freely, is here to stay. But it will then now get linked into business models which are going to be robust.
Okay, I come to you now, Meena, and not painting it all with the same brush, digital healthcare selling, which I did not. The advent digital healthcare would also mean upgrade in various technologies, AI, next generation networks like 5G, and so on, and we're going to talk about it. Let me ask you this first, Meena, that Amit said that the first reaction when the COVID happened was you don't know how to react to it. And you perhaps got rid of a lot of cobwebs, and perhaps I'm assuming that he meant that the healthcare sector turned out to be anti-fragile or stronger. And the worst part was it actually took a pandemic and a public health disaster of this scale for us to do this. If you were to start a company post-pandemic healthcare and a pre-pandemic company in healthcare, how would those be different? What really have we learned in a much stronger way here?
So, one of the things that the pandemic in the last 18 months has brought to fore is a lot more of acceptance of a digital way of working, which could be communicating with the patients or with the doctor or the providers. Secondly, back end, like Amit also said, getting the data together. So, but there's one piece which is still very, very critical, and that is on ground presence, on ground touching the patient and actually working with them. So any new company that we create today would ideally have to bring the two pieces together. Digital, just digital alone, and there is a lot of focus on just digital and the mouth of the funnel and how fast and how wide it can reach. But let's be very honest, healthcare is not just about having a consultation with the doctor or having medicines delivered to you or having a sample picked up. There's a lot more that needs to happen on healthcare. So today or tomorrow, anything that we do, in my view, has to be a combination of the two. So I would, if I was to build a company again, I would be much more digital first, but I certainly would have a lot more of. So I'll continue to have a lot of presence on the ground and combine the two, because that's then you really are solving a problem completely. The other piece is that what is the piece which was missing in the healthcare ecosystem was either you don't do anything or you land up at a clinic. There were only two modes in which most of the patients behaved. Now there's a different mode in which you can behave. You can start to talk to a doctor, maybe get some tests done, maybe you can have somebody come and help you at home, and then at the right time you go to a clinic, and that whole piece was missing in this country. So I think the this what has happened is that the pandemic has brought to light that what this piece which was missing, which is digital health, health at home, community health, all these three are as critical as the facility based care. So I think even whether the regulators or the private providers or the insurers, everybody is now realizing that we missed an entire section. We need to have brought it in. That was what required, and the pandemic, like we said, has shown that importance. So, if I was to build a country again, I would do a lot more on digital front, but certainly be physical also, and see how much of community health can also be brought in, because those three pieces are the missing pieces in our healthcare infrastructure in this country.
Okay,
Can I just add
Satish.
on to
Sure, sure.
that with your
Yeah.
permission? And I completely endorse everything that Meena said, and I do believe that as we go forward, one of the key areas that all of us will get focused on is going to be on preventive healthcare or predictive healthcare, and ensuring that we don't actually fall sick. What COVID taught, especially COVID 2, showed us that regardless of whatever infrastructure we have, is never going to be enough. And I think one of the biggest benefits that digital healthcare can provide is the grassroots stuff that Meena was talking about, point of care testing, analysis, and then being able to link. We saw immediately after COVID hit the migration from large cities to tier 2 and tier 3. And that is the infrastructure that won't get built very early. The only way we can service this is through digitization.
Okay, so a lot of consensus sort of really building in that what the pandemic has really unleashed in terms of opportunity is digitization, sharing of data, agility. And to Mina's point, I wanted to dwell further on that also, this entire aspect of the coexistence of online and offline. And she sort of very clearly said that if I were to start a company post pandemic, of course, I'll go digital first as my communication strategy or the first point of contact, but it has to be well complemented with a very definite offline presence. Satish, I come to you. So we are sort of gearing the conversation more towards the future of healthcare now. Amit also pointed out the fact that in the future it will all be around preventive healthcare. And I also mentioned in my opening remarks that perhaps the future will be determined more towards the healthcare and person's well-being throughout the year and not necessarily responding to illness. If you want to sort of combine both these aspects, you have also invested so many traditional companies. So, what does the future of healthcare look like? When you talk to a KIMS or a Cloud9, how much of this digital healthcare narrative is coming into your boardroom conversation with promoters? What really does the future look like? Is it an offline to online model, a combination model? What really is it?
No, sure. No, I still think that this is omni-channel the way to go. And the way I look at it is slightly differently. That even within the same company, I think what do the traditional companies have? I think they have great infrastructure. They have a good or a great clinical team. There's a lot of learning within that clinical team in terms of protocols, the way of treatment. Uh, but unfortunately, it was all used episodically in the sense that you get a patient, you treat him for a particular treatment that the patient came to your facility for, and he's back out. And I think what this gives us, I think when you combine digital and technology, the way one should look at it is saying that if you look at the entire life cycle and if you treat it as wellness and rather than episodic treatment of a sickness, and I think that enlarges your scope quite a bit, which means that starting from just regular preventive wellness, preventive diagnostics, to regular consultation, advice, and then escalating to a hospital or actually a treatment. That becomes very important, and the reason you would want to do that now, the way to look at it is saying that you are present in a few centers, while you possess a wealth of knowledge and clinical expertise within yourself. Now, how much can you reach that out to a wider audience and a wider market? And that is what we are focusing on. And that means that if you're focusing on a wider market, wider audience, you need to use digital, you need to use technology to be able to reach out to them, start early, engage in the entire journey, and get only a few to your hospitals for treatment. And that's the best optimum use of the facilities and the infrastructure that you have, that you use them for only treatment where it's required and work for the overall wellness of a patient. And I think this is very, very central to our discussion in the boardroom. And I would still admit one thing, that while all the traditional healthcare system, while we have all made moves on the digital or technology, how much have we used data? I think we are still in the beginning of that journey, in the sense that there is past data, there is continuously data collection in terms of when you shift to digital and technology, and various kinds of data, which is in terms of patients, what they have been prescribed, what they have been treated on, the diagnostic data. Now, how much have we really used that data? And I think if I have to put my hand on my heart, I would say that like really, really small progress made there. And I think that's where the benefit comes from. And I can draw on an example where I've actually met the Kaiser Permanente system in the US. And I think the way they invested so early in technology, built that data, used that data for wellness, optimize the facilities or the infra that is required for treating a certain segment of population. I think that's where we need to get to as a market in India. And particularly so because in our market, if you see, all healthcare facilities are concentrated in a few metros or tier one towns. And there is a huge demand supply mismatch when you compare between metros and the tier 2, tier 3. And the one way to democratize the entire healthcare system is to use digital and technology. And it's very, very central conversation at the board level. There are investments which are happening, and that's one of the focus of the entire management team, and not just to say that the traditional 2 years back in terms of what they used to deliver as let's say as something as success in the companies.
Okay. So let
Shrija,
me. Sure.
can I just come in over here for a
Sure.
second?
Sure. Yeah.
So, I completely agree with Satish that data is something which is the superpower or the super structure that can help us really improve the quality of healthcare. But I see a fundamental problem that even if like all his companies, Cloud9 and Kims, do a great job of collecting data, the problem is that each patient works goes across so many different providers and so many different companies across both public and private in their entire journey, that unless you have a way to pull it all together, you really don't have a very good handle on that. So I think there the government needs to step in, and I think they're trying some things with the healthcare infrastructure, healthcare data infrastructure that they're talking about. But that needs to be on the front burner for it to become meaningful, for this whole data journey to become meaningful. Otherwise, we'll still be working with small silos of slivers of data, which may or may not really give you the full picture. So that was one point, Shrija. And the other point that I wish to make is that while all of us want to focus on wellness and continuous support to a patient so that they remain well and not fall sick, who pays for it is always a problem. And expecting the consumer or the patient to suddenly sit up and become very conscious about their health, fine. I mean, they'll do that for the next 1 year, but very soon we'll forget about the pandemic. We'll forget that those who had chronic diseases are the ones who got sicker and perhaps lost their lives. We'll forget all that. We'll go back to our normal ways. How do you make that a part of our psyche? It cannot happen just by expecting people to change their behavior. There has to be something more. The payers have to insist upon it. A lot more of insurance coverage. So there has to be some incentive that needs to come in into the system, which is also missing today.
And
That's
just to add on to
yeah.
that, if
Sure.
I may, I think
Yeah.
both Meena and Satish have hit it on the nail. When you start comparing systems across the globe, the standardization, especially in the US, and by no means am I endorsing the US healthcare system, but the standardization in the US healthcare system is driven essentially by the payer, which in this case is the insurer, who demanded two things over many years. One is that the data has to be real, it has to be live, and it has to be standardized, which we don't see in India. And the second, that insurance is also encouraging and making it easier for people to get into wellness and get into preventive. So they are helping incentivize it. So now we are caught between the devil and the deep sea. The government does not have the wherewithal or the resources to pay for everybody's wellness programs. The insurance companies, for some reason, have still not jumped on that bandwagon where they should start incentivizing people to be healthy. Until we don't have that stick to force it. Otherwise, we'll keep having utopian conversations on people should get wellness checks done. How many of us actually get it done annually?
But that's where you investors are betting on, right? 360-degree wellness. Let me ask a straight question to both the investors in the panel here. What is the most exciting piece as an investment thesis right now? A standalone traditional hospital, or what we media people, as Amit alluded to, paint everything with the same brush, digital healthcare? I'm assuming a digital insurance company, an AI healthcare company, all these things are much more sexier. So what is more interesting? Let us ask this to the investor. Meera, you want to have a question for the investors here? You can also ask them too.
I'll let Satish take it so I can learn from him where I should be investing.
No, Shrija.
Straight question. The what are the
Very
sexier
well.
areas? Yeah,
I
yeah,
want to
Meera,
say
you want to ask?
that you lobbed it very well.
Yes,
No,
Satish,
I
go for
can.
it.
No, I can go, Shrija. Frank answer to this is there is no one answer to this. I think we are looking at it as a portfolio, in the sense that all of the things that you measure. I mean, let's step back. Let's look at the even when we say digital healthcare, like Dr. Amit corrected, there are various aspects to it, right? And it is coming from different sets of players. There is an entire, let's say, an online pharmacy now getting into diagnostic and getting into other areas. There are hospital players who are getting into digital and finding how best can they use digital and technology to reach out. There are diagnostic players who are doing the same thing. There are third-party administrators, insurance TPAs, who are doing the same thing. And like Amit said, there are insurance companies who are saying that can I come up with a wellness package? Can I devise a package? It will take time. I'm sure it's not as it's maybe even in terms of clearing regulatory hurdles and getting it passed, it will take time, but it will surely come. I think you have players from different angles. And I would, if you extend the entire argument, you will also have medical devices in terms of point of care diagnostics if they can come in. I think everyone's trying to get in a lock on the patients or the customer, and trying to build out from there in terms of how can I build a larger play and make it a little more comprehensive where I get the benefits of everything. And I think that's how we look at investments. I mean, if is there an ideal company which has got that lock in and done everything? Maybe not. There are a lot of potential companies who are making the right moves and going on in that journey? I think yes. To that extent, there are several opportunities, be it in the traditional healthcare system or in the new age digital first healthcare systems. They're all moving in the right direction in terms of addressing this problem in a comprehensive way, and trying to bring the band for themselves. Because in the healthcare system, if you look at it, when you look at it and overall, and you're trying to say that I'm going to do good for the patients, trust becomes extremely important. If you are doing very transactional, you get in a customer, do that transaction, and let him go. You have no right to retain that customer for the next time. So who is that? And I think a lot of people are working on that in the sense of how can they build that brand based on a customer trust, because there is an information asymmetry in the healthcare sector. You can't wish away that. So who's making all the right moves in terms of building that brand based on trust, and how are they doing it is what we are watching. So it needn't be in one particular space. I think a lot of players are making some of these moves, and all of them are making the right moves. So there are several opportunities and several players to back here.
Satish, you did
Uh,
not answer my question clearly. You gave me a long answer for a very straight question, and you
no,
told me the various aspects of health. But let me simplify this
no,
question
Shrija,
further.
no,
Give
just
it in like, yes,
one line answer, Shrija. We are evaluating everyone, and this is a honest answer. We are, as we speak, we are already investors in traditional
yes,
healthcare
you are.
providers who are moving digital. We are evaluating opportunities who are digital first, starting there, and then trying to say that how can we build infrastructure on the ground and be a more omni-channel players. So we are evaluating both, and I think both of them have their play here.
So you're saying both of them are equally appealing. It's not that one has a better investor appeal or a better higher valuation quotient right now. There's nothing like that.
I think if you balance out opportunities and the valuation expectation, I think both are even Stevens.
Okay.
Let me put it that way.
Okay, Amit, I have a much more simplified question for you. We have seen one health
No,
tech
I
unicorn.
can answer this. I can answer this now that Satish has
Okay.
given me how to handle it.
But
It's
my
actually
question for you is that from where will we see the next health tech unicorn coming from?
okay. I'll let me break it down. See, we have the benefit that we have two platforms through which we invest. The first is Quadria, which is growth private equity, and the other is Health
Mhm.
Quad, which is an earlier stage. And the ticket sizes are completely different between the two. So I'll answer your question directly by giving you some subsectors of health that we are focusing on, which we believe will then lead to further growth. So to me, on the services and pharma side, it is single specialty in hospitals and single specialized molecules or a smaller repertoire of molecules in pharma is what we are excited about. Meena already alluded to it. The the stuff that we are seeing now in healthcare financing, the newer models that are coming out, that to us is of great interest. So we do think that we would be investing there. In the medtech space, I am personally very, very interested in anything that is going into point of care testing and doing as many tests in the community rather than the community sending samples to us. So that would be our third area. And lastly, as we start talking about this whole area of digital health and the cross fertilization with or artificial intelligence. So telepathology, teleradiology, tele-ICUs, things which are getting more and more sophisticated and where I face a challenge of manpower. So for example, just simple example, finding enough radiologists to do the millions of CTs and MRIs in this country will never happen. But if I can invest in something which makes me smarter to screen out which are quite clearly normals and only leave the abnormals for manpower, those are the kind of companies that I'm interested in.
Okay, that's a fair answer and a clear answer. Then Satish, I would give you that. I come to you now, Meena. You heard both your colleagues in the investing space talk about what is attractive to them, what is perhaps non-attractive, and why they're looking at certain segments. My question to you is that you perhaps wear both the hats as an entrepreneur and also as an investor. You've also invested in a few companies. What really are you thinking and are you seeing in terms of trend? Do you think that this one space is perhaps overheated or is a fad in the healthcare space? Being more on the ground and from practitioners' perspective, what would that really be according to you?
See, advantage of being in a country like India where everything is in fairly early stages to make it a little softer touch. There is everywhere there is an opportunity, and that is the reality of it. And everybody is trying various models, and there's no model which is proven as yet at all. So the best man may win. So it's fine. So there might be five companies who are doing doctor teleconsultations, five others want to do chronic disease management, three come up with elder care subscription. There are all kinds of things, and the best person will win. So frankly, it is not about is there enough opportunity, and there is. And the beauty is that I don't think health is going to be a one person takes all kind of a market. You don't, it's not going to be an Amazon, Flipkart, you find two places which is the cheapest of the two. You, anytime you want to buy anything, you go to one or the other, check what the prices are and buy. That's not how healthcare works. Healthcare is a little more deeply thought through, especially when you're doing a combination, when you're doing a real service, you're not just doing a transaction. If you're doing a healthcare service, which is a combination of something digital, something on the ground, something in a facility or in your community, then what you're doing is touches people so close to themselves that they are not, the switching costs are higher. So fundamentally, I feel that there's opportunity for multiple players in this to take this forward and build something. But one area where I think that perhaps we there might be something interesting that we may want to look at is how do you get access to rural and semi-urban areas, and not just a teleconsultation. I mean, just because the government has created a e-Sanjeevani platform, will everybody now get teleconsultation? Will they be able to get it? What will they do thereafter? How will they do the on-the-ground conversion from the teleconsultation into whatever needs to happen? That problem, I think, is something which is might be an exciting one, which could lead to a fairly large opportunity in the country. The why nobody has jumped into that is that you don't know the monetization yet, because you're talking about really small ticket sizes or inability to pay. You're probably going to bump into the public health system or the quacks on the ground. How do you coexist with that and still create something which is viable? I think that is something is a problem that is waiting to be solved in my view.
Okay, how do you look
Srija,
at? Yeah, sure.
Srija,
Yes,
there you.
Nitish.
No, no, there you go. See, she has exonerated me.
No,
There are
I,
several-
no, I haven't. Satish, please carry on. You want to make a point essentially on last mile delivery or healthcare at large. I think you want to say something on those lines.
No, I agree, Srija. No, on a lighter note, I was saying that she has exonerated me, saying that there are several healthcare players looking at it in different ways. No, I think there is a good point that Meena makes on last mile, how you can use digital or technology for last mile. And that's a need in India. Like I said, infra, and when I say forget infra, I think we always think in terms of buildings and centers. Even if we take
Mm-hmm.
doctor teams and clinical teams and expertise available, it's very, very unevenly distributed, right? And I think that's where digital and technology has a large role to play in terms of providing healthcare where people are. Even now, there is healthcare travel. If you look at it, there are large regions in India where people travel to different regions just for availing of healthcare. And to that extent, if you can use digital and technology to solve that, I think it's a really great opportunity that is there.
Okay, we spoke about opportunities. We spoke about what digital healthcare can unleash for ourselves. We spoke about the mental modes of thinking of building an anti-fragile company, perhaps post-pandemic, pre-pandemic. What really is the ask from the government, the sexy or the non-sexy investment themes for the healthcare investors here. Now, my question is really is what we are seeing in the private market. Let's talk a little about that. Upswings in M&A, IPOs, a flood of new and eager entrants, unjustifiably high valuations, and more. Now, with so much enthusiasm building in, and I want one honest revelation here. Is FOMO building out for healthcare investors when they see their colleagues perhaps cashing it out in consumer internet spaces like edtech or restaurant spaces, which are perhaps, fintech space, more unicorns being churned out? That is the first. And second, do you really see a bubble playing out in the private markets? And does the digital healthcare sector have an incoming bubble to worry about, or is this a maturing market? This question is for the investors. I'll begin with you, Amit, and then go on to Satish.
Okay, let's take it from top. Number one, you cannot compare us to any other sector because this is life and death. At the end of the day, unfortunately, this country, this region will never run short of patients. We can keep building as much infrastructure as you want. It will never be enough. So every time people talk to me about competition in this space, it's laughable because by the time we start building infrastructure, it is never going to be. That's number one. You're absolutely right about the obscene valuations that exist in healthcare, but that's not because of greed or people trying to cash in or cash out. It is purely due to lack of good quality companies, period. It's a scarcity deficit. Now, what we've seen is COVID, non-COVID, pre-COVID, post-COVID. At the end of the day, healthcare is a fundamental right. It will continue to grow. And we've seen that in the past. So does every single investor who looks at it and says, why shouldn't I invest in healthcare? It makes sense. Lastly, when I look at the sector and its growth, to me, it's a never ending growth. I don't call it a bubble. It's a bubble depending on when you got onto that treadmill. But if the fundamentals of your company that you've invested in are correct, your ethics and integrity are in place, and you solve for these kind of black events that just took place, I am not seeing any kind of issues with healthcare, and maybe it's my bias, but I don't see any fundamental issues in the growth of healthcare in India in the foreseeable future.
Okay, Satish.
No, I agree with Amit here. It is an opportunity. And I think one we should recognize is what pandemic has done also is that I think it's not only the investors, it's not only the providers, it's not only the players in the ecosystem. I think there is a wide overall recognition of the importance of healthcare. Even if it was overlooked earlier, I think what this has done in the last 2 years, there is a great realization that healthcare system in India needs to be developed. There has to be investments that need to go in. We have to find solutions of solving the problem smarter. And I think there is that recognition, and I'm saying across at the payer level, at the government level, at overall investors who had earlier probably not looked at healthcare as much. And I think that's the one that the pandemic has done. And there will be opportunities. I know that consumer tech has probably done far better, risen far higher, but this is a little more secular. This is more sustainable. This is secular. There is growth available across whichever segment which you pick in healthcare. I think that's the way we view it here.
Okay. My last we are getting towards the end of the conversation, but before we do that, and I think we should spend about a couple of minutes talking about the mental health space. I mean, essentially, a ticking time bomb that we're sitting on. Are you all also seeing opportunities unleashing in that area? And how is that as investment thesis? And how attractive it is? I'll get on to you, Meena, and then on to other investors. Yes.
Sure. Oh, absolutely right that mental health has come probably a little bit more out of the closet than earlier. There is a lot more dialogue, a lot more of acceptance and understanding that this is an issue. That said, I think it still is a challenging space to create a monetizable product, monetizable solution that people will take and it'll grow. I think it is still in a stage where uh, people are willing to, especially if it's an online service, and it's good because there's a degree of anonymity. You can speak to somebody without having to go somewhere. All of those things are there. It's good. People will have the conversation. They'll are very happy to have the free conversations, but converting it into a paid, real, deep conversation with somebody is challenging, and that requires very people who've got a very deep experience in this area. So unlike probably some of the other services, this requires. I mean, probably like any other healthcare service, you really need somebody who knows how to work with patients, who knows how to counsel patients, who know how to provide medical treatment. Perhaps a psychiatrist population is very small in India. So there is a lot of people who've come out and said, we are life coaches, we are counselors, we are A, B, C, D, and are providing very superficial solution. So that can create a different kind of a challenge that people get either lulled into comfort saying, "Haan, baat kar liya, so I'm good now," or it they provide guidance which may or may not be of the right level and right depth. So I fear that in the hurry to grow this, we may end up trivializing what mental health really needs. So that's my concern there. There is no doubt that the need is there. We have to create really strong, probably certification programs which make sure that the right people are providing this. Otherwise, there's a lot of flaky stuff that can come up in this area. I worry
Okay.
about that. Yeah.
Okay. Any last thoughts from any of the investors here? There could be a lot
Just
of
on
washing
just on
happening in the mental
Mina's just
space.
on Mina's
Yeah.
point, I think there are three areas in mental health which we still will need to grapple with. The first one is social stigma, because that still is a problem. People, while they're beginning to open up, are still not admitting that they may need psychological counseling. The second is quality of manpower. I couldn't agree with Meena more. It's very easy to label it, and then it's become very easy for psychiatrists to just hand over pills because at least you're treating a symptom. And the last, which we've been alluding to throughout our conversation, is the whole payer universe. Who's going to pay for it? If you're paying out of pocket, people will take one or two of those sessions, drop out. But if you had a robust paying system, things would be different.
Okay. My last round of questioning for all the panelists here, and before we get the rapid fire, is that we saw in 2021 is that digital health venture, which includes everything across the space, kind of went berserk. I mean, the pandemic-induced run to rate fund was up by 22% compared to 2019. And that was something that no one really expected. It was a ride, and we saw this across the something called digital pandemic-induced growth that we have seen. Now, my question, and if you were to give me 3 pointers on how does an anti-fragile future healthcare company look like, where you have grown stronger, learned, perhaps emerged stronger from all the challenges that you went through 1.5 years back, and just to going back to what Nassim Nicholas Talib's point was that the resilient resist shocks, but anti-fragile gets stronger. 3 pointers on the future healthcare anti-fragile company. How will that look like? What are the characteristics of it? How is one looking at building that up? I'll start with you, Satish, get on to Amit, and then Meena. Yeah.
Yeah, sure. Um, so one is, I think, the way I see it is, I think the customer centricity has moved quite a bit, and I think maybe we should have spoken about this even earlier. I think earlier it was a patient going to a healthcare system. There was an information asymmetry, just with people taking second opinions, consulting with a wider variety of doctors across different regions. I think that just that the focus on customers has increased a lot. So if you have to succeed here, and if you have to stand against disruption by newer players who are coming in, I think the focus on what the customer needs, everybody has made a movement. I'm not saying 100%. I think that realization has dawned quite a bit, and it's going to be extremely important. And how do you do that? I think that's where you leverage digital and technology in terms of having that data, using that data better, using it for wellness, treating it holistically. I think that's the second thing, that's where digital and technology helps you a lot. The third one is, I think uh, you could increase the productivity of the system much better using this digital and technology. And I think where I see the shift that's happened is that the doctors have, in terms of how they've adopted, how they have liked this, how they are increasingly willing to use technology, and how they are increasingly finding that having technology, having AI, which helps them in their decision making while the control is still with them. I see a lot of movement, and that brings me a lot of hope in terms of where the healthcare companies would be headed in the future. I think those are the three aspects that I would look as strong points whenever you are evaluating or looking at a healthcare company in terms of what helps them succeed.
Okay, Amit.
Yeah, this is one of those classic innocent questions which are harder to answer. So I'll put in my 2 cents worth. I think to me, whenever I look at it in the future, it's going to be three main things. It's going to be what the company is doing with data utilization and its ability to analyze it. The second is cost efficiencies using digital and making sure that those are robust to carry forward. And the last is manpower quality, because finally, everything that we do in healthcare is very dependent on our quality of manpower. And I don't think yet in India we have a culture on focusing on training and upskilling.
Okay, Meena.
As always, when you come at the end, all the good ideas are taken. So thank you for putting me at that place. So
We're looking at all the ideas from you. Yeah.
couple of thoughts from my side.
Sure.
One is that I think there is an opportunity to make the healthcare system more patient centric, not just from the consumer or not just from the experience perspective, but more from a patient centric treatment. So, how can we make the treatment much more um, uh, customized to the individual and their disease, and that's where the usage of technology can come in very handy. You make it more and more one person oriented rather than population oriented. So that's one thing that I believe there is a journey to be done from a company individual as companies. being lightweight and being very capable of pivoting or focusing on new ideas, the nimbleness is going to be super important. Healthcare so far has always been about creating large infrastructures and maximizing the output out of that. What this has shown is that that's one model, no doubt, but you need a model of being able to nimbly move along with how the customers' requirements or their thought process or how the diseases churn as well. So these are, I mean, you asked for three, I'm giving you two.
No, these are very interesting points. All of you came up with some very interesting points and what a lovely conversation. We spoke about customer centricity, being agile, being nimble footed, not being rigid, talking about more personalized solutions to healthcare, uh, better utilization of data, manpower quality, such great mental modes of thinking on building a great, truly anti-fragile healthcare company. We spoke about quite a few things, but I think we should definitely spend also some time talking about the National Digital Health Mission that would provide identification numbers to everyone, which also the PM Narendra Modi spoke about, expanding access to timely and affordable healthcare. How would you gauge its progress? 1 year has sort of really passed in the betterment of digital healthcare sector and enabling private and public solutions. If some perhaps candid answers and suggestions to the center were to come from this August panel, what would that really be since we have 1 year of body of work passed by? I sort of begin with you, Amit, and then get on to Meena and then Satish.
I think, as is true of a lot of things that we do in our country, is the intent is always right. The reason why we're doing it always makes sense. The devil is in the execution. We are a massive country. It's just going to take us a long while before we put something robust in. And I do think, and this may be controversial, but I do think without a stick to enforce it and making people get onto the bandwagon because they're going to get some benefit out of it, till we don't do it, it is just going to take much longer. So whether it becomes mandatory to access services or an incentivization model by which by me providing the data enables me. And lastly, there's always the issue of privacy and the misuse of the data that I provide, especially when it's something that sensitive about my employability, my ability to move to different areas, all of those. And sometimes for us, that's a big issue, especially where data leakages are reasonably common.
Okay, Meena, to you on digital health mission, national health mission. What do you think about that?
So
Yeah.
I think the ideas are great, and some very good minds are working on it. Um, I have a couple of concerns. One is, of course, the why, while on one side, why will the customer or the patient share the data is one. The other is, how do you get the various private and public health infrastructure providers and all of them to become part of it? What's in it for them? Why should they do it? How, if it's, are we just collecting data and making the whole teleconsultation or whatever the first kickoff point so easy that anybody who has a big funnel of people population can just make use of the network that has been created by everybody else? So there is a little bit of concern in the mind that a lot of healthcare companies have come together and spent a lot of effort in creating a network of, let's say, teleconsulting, but somebody else who has just a very large population of digital customers coming in without necessarily having to create or invest in that network can benefit from that, and then they have access to the data as much as anybody else. So is it a level playing field? Will people feel comfortable with that? So that is a problem thing that needs solving. I don't have the solution for that. I can just say that I see this as a concern in the minds of providers.
Okay, fair point, Satish.
Uh, yeah, now I'm the last. So, no, I agree with the two. I think the way I look at it is just adding to what Dr. Amit said. I think the intentions are right. How do you get the usage to be far higher than what it is? And I see it both. One is stick and the other one is incentives. And I think you have to use both. And I'm using incentives in a way to address in terms of what Meena alluded to. I think a mix of both is required in terms of wider acceptance, and I've seen it in a couple of other markets, like in the Middle East markets. And I think a lot can be pushed from the payer side or the insurance side. I know that the penetration there is higher, but as long as you make it coming from there, and that is an essential part for healthcare providers to get paid, and for consumers to get paid for their insurance, I think it facilitates in terms of the use of common platform. So at least that's one way that I've seen at least work to a certain extent in some markets, where uh, how you capture data becomes standardized, how you codify the data becomes standardized, some of the treatment protocols become standardized. So it's a great start to start from that end, rather than the fragmented healthcare provider space. Yeah, stop that.
Okay, so intention is well thought out, great start, but a long journey to go, and some concerns already coming to the fore. Now it's time for some quick rapid fire after this enlightening conversation that we've had, and some great revelations have also come to the fore. I'll start with you, Amit. The first thing that came to your mind when the Zomato IPO happened.
Well done.
Okay, your how did you feel for the investors in Zomato IPO who cashed out like crazy?
I mean, every IPO these days is a bit of a lottery, isn't it? I don't know
Okay,
too many investors are looking at fundamentals of companies.
okay. Is this a message to your colleagues in the private investment space?
No, honestly, this is I do feel that while I'm very happy that the IPO market is doing that well, I do wish a lot of people are just jumping on it without understanding what they're getting into.
Shrija, I'm
Okay.
sorry. I had a
Yeah.
6 o'clock which I'm late for, so I have to leave.
Okay. Okay. Thanks, Meena.
Okay.
Thanks for that.
Thank you.
Okay.
Bye.
Thank you. Okay. Okay. I'm just left with Satish and Amit. Amit has already laid out his points on what he thinks about private market valuations, where they are headed. So, really, why are investors not using the B word? Is the question then. Maybe
Sorry, I thought
Satish, you can take
uh,
the bubble word.
Yeah, no, I think Amit did use. We did say that it is high compared to what it should be. I think Srija, the other way to look at it is also growth. Is we are seeing a lot of growth, and we are seeing it in some of these companies which are getting valued. I think they have grown well, and they've grown for quite some time on a larger base also. While initially people would have thought on a smaller base, they've continued to grow, and they've continued to evolve. And I think one way of thinking about valuation is to look at, probably people are just seeing in terms of what can they evolve, or what is the opportunity set here, what's the potential that they can reach. I think that's the reimagination that a few investors are driving here. um, yeah, one never knows, but it seems to have worked till now. What would have looked, let's say, earlier as very expensive because of their growth, people who had gone in even when we thought it was expensive, I think it's justified that with the growth and the improvement in even, let's say, the profitability that some of these companies have shown.
Okay.
Having
So,
said that, I agree with Amit that there should be a bit of you don't want a mistake, you don't want a bad story which just spoils the entire run. But
can
yeah.
I just
okay.
add one other thing for your viewers? I think it's very important that while we've been talking all about all the robustness and all the good stuff about healthcare, this is also a very tough sector to make money in. Neither Satish nor I make money on themes. We make money by doing the hard work with companies, which is to grow them. And while there is a natural growth because of the lower base where we are starting off, this is a very domain specific sector which requires an enormous amount of patience, expertise, and understanding of how to make money. So, this is not
Okay.
just about listing and running away with it.
Okay. Okay. My last like 2 minutes, quick answer for both of you. What was the best part about the 55-minute conversation we had? What was the key takeaway? One key takeaway from each of you. Satish, what was one key takeaway for you for the last 1 hour? And then Amit, and then we wrap this up.
For me, I think it's just the use of digital in changing the healthcare landscape in India. And when I say that, it's not only provider, it's just provider, insurance, payers, probably other new models that will come in. I think we are at a time and space where we're looking at it holistically rather than individual segments in terms of what they're doing. And I think that's one of the key takeaways from this conversation, that it's in terms of where healthcare system is headed and not where individual segments are headed.
Okay.
For
Amit?
me, actually, it was the fact that we come from different backgrounds and different ways of looking at the business of healthcare, and the uniformity of ideas, our identification, even we came from disparate thoughts on what the problems are, what's the good, what's the bad. To me, that's very encouraging. That at least we are all heading in the right path, and hopefully, we come together for the common good.
Okay, thank you. Thank you for your time and energy for this panel. Thank you to audiences for being so patient. Till the time I see you next, goodbye and good luck, and keep watching the Winning with Antifragility series. Thank you and bye-bye.
Thanks again. Bye bye.